So we give sub-Q injections. They're great. We give insulin. There's other things that we can give sub-Q. For Lovenox, I always remember Lovenox. So let's give it in those love handles or those areas right in the waist. We call them love handles. Many of us have them. But giving a sub-Q injection, there are many areas that you can give it. When I'm giving it to someone clinically, I like to give it in an area that they won't use once they get home. I like to give it in this outer arm area, but they can give it abdominally, into the legs, thighs. So you teach the patient as the nurse, but I'm just going to demonstrate how to give a sub-Q injection. Let's get started. I'm going to go ahead and wash my hands, getting ready to give a sub-Q injection. I've gathered my supplies. I've exposed the arm, abdomen, or thigh that I want to inject. I'm going to go ahead and put my gloves on. I'm going to go ahead and open my alcohol wipe. I've exposed the arm area that I want to do my sub-Q injection in. I'm going to start in the inner area with my alcohol wipe, cleansing outward, full circular motion. I always tell my students, if they do clean anything and it's really dirty still, just go ahead and get another alcohol wipe. Clean again, it will not hurt. While that's drying, I'm going to go ahead. I've done all of my rights. I've checked I have the right patient, the right med, the right route, I've got right time, right dose. I've done all of my rights. My 6 rights have been checked. I've done my 3 MARD checks, and I'm ready to get my injection ready to give a sub-Q injection to my patient. I have a multi-use vial of insulin, so I'm going to go ahead and open that up. And I'm going to start by cleaning the stopper in a circular motion, and I go ahead and do the whole top. I'm going to set that to the side to dry. Then I want to go ahead and get an insulin syringe. They are orange in color. It is very important that if you're giving insulin, you use an insulin syringe. Sometimes I'll hear nurses say, well, you can calculate and use another syringe. But I tell and teach all my students, this is universal. It is measured to have accurate units. Use an insulin syringe. You will not go wrong. So I'm going to open my syringe while everything's drying. I know that I'm going to give 10 units sub-Q. I have my gauze ready. I'm going to leave it right here for my patient. I'm taking off my cap. I do want to show you one thing about an insulin syringe. The safety on these actually turns, so you can actually really see the measurement if needed. And you have 2 sides usually of measuring. So if you want to move it so you can see the numbers and you have an accurate visualization of what you're giving. So I'm going to give 10 units. 10 units of air is drawn back. I've cleaned my vial. Going dead center of the stopper. I want to push my air in. I'm going to take my vial and my syringe. I'm turning it over. And I am going to draw out my 10 syringe. Now, a little trick, a little pearl. I always draw a little bit more back to make sure there's no air bubbles. And then if I need to, I can hold the air bubbles out by hitting my finger against the syringe. And then I'm going to push back to the 10 because this needs to be very, very accurate. Once I'm there, I'm going to pull out. My vial will sit back down. Now, if I flip up my safety, it will lock. I do not want to do that. I can at this moment in time while I'm going over towards my patient, actually, and I'm going to move this back so you can see, do the scoop method. So I am going to actually take my syringe and scoop my lid back on, snapping it on, ready to go. So I am ready. I have my gauze. I've cleaned my area already. And I'm going to put my gauze in between my fingers. I'm going to uncap. I'm going to explain to the patient what I'm getting ready to do. And for a sub-Q injection, you want to gently pinch the skin up. You don't want to grab the skin and pinch it hard and up, or you will push muscle up into that area and end up giving your sub-Q injection into the muscle. You want to maintain in the sub-Q tissue. So I'm ready to go. I gently just pinch up slightly, and giving a sub-Q, I like to go in at a 45-degree angle. When in doubt of your angles of syringes and needles, just know up and down from the patient is 90, half of that would be 45, and almost flush to the skin is just slightly above is a 10 to 15. So you can always, if you're not sure what 45 is, don't stick the patient, but just kind of go like this. That's your 90. I'm ready to go. Big stick, I go in, making sure at a 45-degree angle I'm there, and then I'm going to gently just push my medicine in. I'm going to relax the skin before pulling out, have my gauze ready. Remember, sub-Q injections, there is no massage afterwards. We don't massage at all anymore for any shots. Evidence-based practice has proven that. So as I'm pulling out, I have a safety on this needle. I'm going to pull out. I'm just going to put my gauze over gently, no massage, holding just slight pressure. And then I am going to engage my safety, which is a thumb safety. I inject and the needle is protected, so I won't stick my patient or me. I am ready to just put that to the side. I'm going to hold just a minute. Take a look. If there's no bleeding or anything else, I'm good. And then lots of times I am the patient that if you give me any injection, I look great till I get to my car, and then I have blood on my shirt or I have blood wherever. So I always have a Band-Aid, put a Band-Aid over it. If a patient doesn't want a Band-Aid, you don't have to. You can just put a little pressure. You don't need to press super hard. We're not occluding an artery. We're just gently pressing to stop any little bleeding that might have occurred due to the injection. Once I am done, everything is good, my patient is good, I will dispose of everything into the trash, and my syringe and needle needs to go to the sharps container. By doing that, we have created a very safe environment.